First of all is the culture change. There needs to be a culture change the way social care providers are engaged with digitally, especially in regards to innovation. Quite often you have innovators who aren't working with care providers, and it's important to encourage innovation and collaboration with care providers. Secondly, I think one of the issues going forward, especially with the new health and care bill, is ICSs. For large providers who operate across multiple systems, it's important to have consistency and the choice, especially in regards to digital care records, which is one of the digital meats of by 2024. So what ICSs need to do and what the government needs to ensure is that if a provider isn't comfortable with the digital care record, a provider which they're being offered to use, they need to make sure there's a choice of two. They need to make sure that there's a choice which they can move to create consistency. And there's also the issue of interoperability between ICSs. We need to make sure that each system feeds into one another so it doesn't create too much duplication. We need to sort of make it so that systems integrate with one another. Another thing is the move towards a national minimum data set. How does that meet provider needs? How are we going to benefit this to providers? There needs to be a clear communication to providers to make sure that they understand the benefit, but also to make sure the individual understands the benefit. Why is their data being collected? How is this being used to benefit their care? Because at the end of the day, it's all about making the quality of life for the individual better. So that's what digitalisation needs to do.
Completely agree. Yeah, completely agree. And I think that point about integration, that's really, really important. Us, when I joined our group, we've got various different systems and none of them were talking to one another. So we're that's not so much the case now, but it was really difficult, and that duplication was so time consuming and pointless.
No, definitely.
Yeah.
No.
Yeah, I think that integration is absolutely critical. Because it isn't just the care records, it's all the other stuff that goes on. So that includes your rostering of colleagues, your payroll, all your audits, the data protection, the data recording. All of that needs to be integrated. Your EMR systems. It's just critical to ensure the time is saved and colleagues actually are able to do things quickly. We're in a situation of recruitment crisis at the moment. We have to make it easier for the people that are working for us, and it has to be something that they're proud to be using. I think that's it is fundamental, and there are lots of organisations like our own where we've gone digital, but actually we're probably out of date. So how do you then sort of upgrade because everything moves on?
Changes so quickly, doesn't it?
Absolutely. So again, I think that the industry needs to be looking at how do you sustain this. So it's all very well to bring in a system or have a choice of systems, but how do you ensure that stays state of the art rather than just lags behind because technology changes?
Yeah, and it's sharing information as well between providers. I think we're all very secretive, nobody wants to tell you what they're using, why they're using it, and we had a conversation the other day about what does good look like. What is your pain threshold, what should your falls number be, and none of us know because we don't talk to one another. And I think having been able to go to another provider and saying we're thinking of using this system, has it worked for you? But nobody seems to do it. It's very odd. Very secretive.
I think it's quite strange because during the pandemic, I was part of a team of dementia leads and I think it's Hannah. Hannah was part of that, and we'd get together pretty much every fortnight to talk about what do we need to do for people living with dementia during this pandemic. How can we share resource so that we're not all reinventing the wheel the whole time? And I think that doesn't happen across the industry all of the time.
No.
It was quite innovative and it saved so much time and energy because we were just sharing stuff so that all of the organisations had the same access and all of the residents benefited from that.
Yeah.
I think it depends on the organisation, really. I mean, if you've already invested in the technology, however limited it might be, then it's probably not going to make a massive difference, other than some of the add-ons like PAINCHEK that we can add into those systems, or we can add in as individual standalones. I think for those organisations that are perhaps smaller, and haven't considered making that financial change, having some funds to go towards it will make a huge difference. As a big organisation, we need to upgrade just so that we can make life easier for our care colleagues and make it more attractive to come and work for us.